Our Story Production presents The Road to Our Story.
Hi, I'm Jason Howland, and welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. You know, February is American Heart Month, and joining us today to talk more about the heart and how to stay heart healthy is Dr. John Haley. Dr. Haley is a cardiologist with Mayo Clinic Health System, and he's also assistant professor of medicine at Mayo Clinic College of Medicine in Rochester. Dr. Haley, thanks for joining us today on Speaking of Health.
Thank you, Jesse. It's a pleasure to be here.
Well, as I mentioned earlier, February is American Heart Month. So as a cardiologist, you obviously specialize in the heart. Can you tell us a little bit more about it?
Well, the heart is the muscle, it's an organ that's responsible for pumping the blood to the rest of the body so that the tissues get the blood that they need to do their respective jobs. Pretty important organ. It pumps about 2.5 billion times during a patient's lifetime, and my job is to try to keep it pumping.
Well, you hear so much today about heart disease. Can you explain what heart disease is? Is it one disease in particular?
No, a cardiovascular disease refers to a number of different entities that could go wrong with the heart. And actually, if you look worldwide, cardiovascular disease is the leading killer of both men and women. A popular misconception is that men are predisposed to cardiovascular disease and women are protected, but when you actually look at the numbers, it's the number one killer of both men and women. And when you talk about cardiovascular disease, you're referring to the coronary artery disease is what most people think of, and that's when we're talking about coronary artery disease, we're referring to blockages in the heart vessels that supply the blood to the heart. And as you can imagine, as the heart is responsible for pumping the blood to the rest of the body, if the heart doesn't get enough blood, then it's going to have a hard time developing blood to the rest of the body. So we want to keep the arteries to the heart working well so that the pump can work well. But that's one area of heart disease. There's also congestive heart failure, which is when the heart can't pump the blood adequately to keep all the tissues of the body, give them as much blood as they need. The heart has 4 heart valves that, if they don't work properly, can cause problems. There's also heart rhythm problems where the heart may go too fast or too slow or irregular that can cause problems with symptoms and may require treatment. And then there's also congenital heart disease, which are birth defects that we're born with, some of which are apparent immediately after birth, some of which we don't detect until later in life, depending on patient symptoms. So as you can see, there's a wide number of things that can encompass cardiovascular disease.
Well, let's start with the one that probably most people are familiar with, and what you talked about first is the blood vessels and coronary artery disease. What are some of the symptoms of that?
Well, when you develop a blockage in a heart artery that compromises the blood supply to the heart, that's people develop chest pain, or what we've typically referred to as angina. And the classic description of that is a chest discomfort that can radiate to the jaw, the back of the arm. Now, classically, people have thought of that being as a left-sided chest discomfort or just radiating the left arm. But I've seen patients who develop chest pain on the right arm or right chest or radiates to the right arm. So it's important that people realize that it's a chest pressure or chest pain or an unusual symptom in the chest that should always cause some concern, and just because it's on the right side doesn't mean it's necessarily not coming from the heart. And then you can also develop symptoms such as nausea, vomiting, or sweating if you're developing a heart attack. And actually, women, especially older women, are more likely to develop more of these atypical symptoms such as shortness of breath or nausea or vomiting rather than the classic chest pain. So anybody who's having those type of symptoms should pursue evaluation to make sure they're not experiencing a blockage in an artery or what we call a heart attack.
And what is blocking those arteries?
Typically, it's plaque, what we call plaque, or which is develops over the course of our lifetime, and if it progresses significantly enough, it can start to block the artery and compromise the blood supply to the heart. And that plaque, a misconception is that something that develops later in life. But really, plaque development can start as early as our 20s. When we've done autopsies of unfortunate young people who have died in traffic accidents or in the military, when you do an autopsy and look at their heart arteries, the initial development of plaque formation has already occurred, even at their young age. So it's important for all of us, young and old, to be aware of risk factors for developing plaque in arteries and trying to prevent that now so we don't develop complications later in life.
And what are some of those risk factors?
There are some things that we can't do something about, and there's some that we can. Family history certainly plays a role in your risk of developing coronary disease. So if you have a family history as such, it's important to be aware of that and be even more aggressive about treating your other risk factors. Then, of course, aging is something that we can't do anything about as much as we'd like to. And so those are the risk factors that we really can't adjust. But there are some things that we can do. The most important thing is to not smoke, and if you do smoke, to try to work on stopping smoking, because that certainly contributes to the development of blockages in the heart arteries as well as all arteries. Similarly, if you have high blood pressure, it should be treated. If we treat the blood pressure, that can help develop problems down the line. And just as importantly, if you haven't had your blood pressure checked, please make sure to get it checked, because there's a number of people who have high blood pressure who aren't aware of the fact that they don't even know that they have high blood pressure. Similarly, if you have diabetes, it should be treated aggressively to help prevent the development of plaque in the arteries. And then if you have high cholesterol, it's important to treat that and get your cholesterol to goal, as keeping a low cholesterol can help prevent the development of plaque in the heart arteries.
Well, let's move on to abnormal heart rhythms, abnormal heartbeats. Can you talk a little bit about that?
Sure. Sometimes people develop symptoms of a fluttering sensation or a skip beat, or sometimes they'll say a flip-flop, and that can sometimes be an abnormal heart rhythm. And the key to treating that oftentimes is trying to determine what is causing that symptom. There's a number of different rhythm problems, the majority of which are benign or easily treated. But the key to treating that is to determine what the rhythm is. Is it due to just an abnormal extra heartbeat that we all frequently will develop, but some people are aware of them and some people are not? Sometimes we can develop faster heart rhythms coming from the top chambers of the heart, what we call supraventricular tachycardias, that can be treated with medications to slow the heart rate down or to prevent that rhythm from occurring. And in some cases, there's procedures that we can do to eliminate that rhythm from occurring. Then there's other rhythms that can come from the bottom of the chambers that are a little more dangerous, that we like to be more aggressive with, called ventricular tachycardia, that require a little more aggressive treatment. So the first part of evaluating or treating somebody is trying to determine what the rhythm is that's causing this symptom, and then determining if it requires treatment or not. In addition, sometimes people develop a slow heart rate that can cause dizziness or lightheadedness, and they may require some medication adjustment or sometimes a pacemaker.
And with these abnormal heartbeats, does it really depend on the circumstance whether or not a patient can actually feel or tell that they're having that abnormal heartbeat, or will everyone always tell if you have an abnormal heartbeat?
No, there are sometimes, we know that sometimes patients may have an abnormal heart rhythm, and sometimes they feel it and sometimes they don't. So sometimes you may have an abnormal heart rhythm and just not be aware of it. And whether or not that's, and again, in many cases, if you're not experiencing any symptoms and it's a benign rhythm, that's not an area of concern. So it really depends. A lot of times it depends on what the rhythm is and what symptoms that's causing. Will oftentimes determine how we treat it.
Okay. What about heart defects? You mentioned those earlier. What are heart defects?
Heart defects are when the heart develops in the uterus, it goes through a very complex development process, and it always amazes me that errors don't happen more frequently than they do. It's just amazing. But occasionally, in the process of development, something doesn't develop properly, and so that leads to an abnormality of the heart. And when people are born, sometimes that abnormality is immediately apparent because it causes problems that need to be treated immediately to allow the baby to live. Then there are others that are less dangerous and we don't necessarily detect until later in life, and how we treat those defects depends really a lot of times both on if the patient's experiencing symptoms as well as what problems we think that defect is causing.
So overall, what can heart disease lead to? Obviously, most people would associate it with a heart attack, but it's not just heart attacks, right?
It's not just heart attacks, although that's certainly one of the major problems, but also over the time it can develop, people can develop, if you have untreated high blood pressure or if you have had heart attacks, you can develop congestive heart failure where the pump does not work quite as well. In addition, sometimes if the heart function is not normal, you can be predisposed to some of those heart rhythm problems we discussed earlier.
So what are some of the typical tests that patients can have done to determine if they suffer from heart disease?
Well, I think one of the most important things is to just have a good history and physical with a physician, to sit down and talk to about what symptoms you're experiencing and then listen to the heart. And that goes a long way to determining what we think, what problems the patient may have and what needs to be done. Oftentimes in the office we'll do something along the lines of an electrocardiogram or an EKG to look at what the heart rhythm is and to see if there's any evidence that they've had previous heart attacks. So it's just an electrical tracing of the heart's rhythm, but we can also use it to determine if we think that there's ever been a previous heart attack or if there's evidence that there's been high blood pressure or that the heart's working a little harder.
And an echocardiogram as well you can use?
Yes, and that's a fantastic tool that we use it's an ultrasound of the heart. And it allows us to look at how the heart functions, how well the pump is working, if you will. In addition, as we discussed earlier, the heart does have 4 heart valves, and that test allows us to look at the valves and determining how well those valves are working. Are they leaking, or are they not opening up as they should? The test can also give us an idea of if there's ever been previous heart attack. So that's a great tool to help us look at people's hearts.
So someone's been diagnosed with heart disease. How do you and the patient, how do you, the cardiologist, and the patient work together to treat that heart disease?
Well, specifically referring to coronary disease, I think the most important thing is to work on treating the risk factors for heart disease. In addition, working to make sure they're on the right medications for whatever condition they may have, and adjusting those medications to eliminate their symptoms as best as we can.
And any words of advice for folks? Obviously, lifestyle changes like quitting smoking and diet, those kind of things, obviously do wonders to help as well, right?
Well, I'm a very strong proponent of exercise, and I talk to all my patients that exercise, I really think, is the best medicine for all of us. And strongly encourage all my patients to try to exercise for moderate duration for about 30 minutes a day. Exercise, it reduces blood pressure, it can reduce your cholesterol, it reduces your weight, it can reduce stress, and it really comes at no cost other than time. So that's the cornerstone, I think, of all treatment. Then, as you said, we want to talk about the risk factors and getting the blood pressure and the cholesterol controlled, treating the diabetes, and stopping smoking. And then we also want everybody to try to eat a heart-healthy diet, which encompasses a diet high in fruits and vegetables, low in fats and saturated fats and fried foods. And I think if we can get everybody doing that, they will be doing all that they can to reduce their risk of developing heart disease later in life.
It's interesting that you would talk about exercise being medicine because the heart is a muscle, and you want that muscle to work just like you would want to work out any other muscle in the body, right?
Absolutely. And I always tell patients, if you don't use it, it's not going to work as well. So the more you use it and get out there and take it out for a spin, if you will, the better it will work.
All right, fantastic. Well, unfortunately, that's all the time we have, but a great topic and a great speaker. I'd like to thank Dr. John Haley, a cardiologist with Mayo Clinic Health System and also assistant professor at Mayo Clinic College of Medicine in Rochester, for joining us today on Speaking of Health. Great.
Thank you, Jason. It's been a pleasure.
Have a great day, everyone, and be healthy.
There you have it, folks. One of the favorite stories ripped from the pages of The Road to Our Story magazine. Let's have a look at another.
Hello, I'm Jason Howland, and welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. You know, most Americans will experience back pain at some point in their lives. It's one of the most common reasons that people go to the doctor and also miss time off of work. But on the bright side, measures can be taken to help lessen and heal back pain, or even prevent it. Here to talk more today about back pain is Dr. Douglas Chiat. Dr. Chiat is a neurosurgeon from Mayo Clinic Health System. Dr. Chiat, thanks for joining us today.
Well, thank you so much for having me.
Well, let's start out first by finding out exactly what makes up the spine.
The spine is actually very complicated. It's made up of bones that we call vertebrae, and these are sort of block-shaped bones that are stacked on top of each other. And in between those bones are the discs, and we've all heard of discs, and those are held together by ligaments, and then we have muscles that provide strength.
You talked about discs, and a lot of people have heard of those. What is a disc? Is it a bone? Is it cartilage? Or is it something else?
Yeah. The discs are the largest avascular organ in the body. And a disc has an outside layer that's made up of very strong connective tissue, just like the ply in a radial ply tire, and the inside portion of the disc is soft gelatinous material.
And the purpose of the disc is to?
Well, the disc is commonly thought to act as a shock absorber, which it does, but the disc also allows the bones of the spine, the vertebrae, to move on each other.
Okay. Well, so I'm going to throw a really, what seems like a simple question to you. We're talking about back pain. What are common symptoms of back pain? Because that's a pretty general term.
Back pain's very common, and I'll bet that almost everyone listening to this show has had a backache from time to time. Most of the time, back problems are caused by the degenerative process that we all get as part of the maturing process and as a result of good, honest work and sports and that sort of thing. In its simplest form, a back problem may show up just as a backache, and that could be due from a muscle strain or a muscle pull. As the discs degenerate and the bones degenerate, those changes can also cause back pain, but they can also start to put pressure on the nerves. And when they do put pressure on the nerves, people can develop a condition that we call sciatica, and that's shooting pain down the leg from a nerve being pinched. Sometimes those degenerative changes can get so bad that it can actually crowd all the nerves and produce a condition that we call lumbar stenosis. And stenosis is a fancy word that just means narrowing. And people who have that stenosis condition may have pain down both legs and may actually have trouble standing up straight. They walk sort of bent over.
The degenerative conditions that you're talking about, is that the vertebrae actually wearing down or becoming smaller, or is it something else?
It's a little bit of everything. The discs wear down, and as part of that wearing down process, they may lose some disc height. The bones start to wear out, and as part of wearing out, they may develop bone spurs. The ligaments that hold the bones and the disc together may also wear out, and as part of that, they may hypertrophy, and that's a fancy word that means overgrow.
The degenerative conditions, is it, are people more prone to it as far as genetics, like family history, or men versus women, that kind of thing?
There are many factors that predispose patients to back problems. Genetics is a very important factor. There's not a lot we can do about our genetic makeup. Age is also a very important factor. You know, back problems are the result of a progressive degenerative process. Now, unfortunately, we can't do anything to control our age. There are some other causes of back problems that are preventable. For example, there are some lifestyle choices that predispose people to back problems. Obesity, which we're hearing more and more about in the media these days, puts extra strain on the back. And people that are obese are much more likely to have back problems than people who are not obese. Other lifestyle choices, such as a sedentary lifestyle, may put people at risk for developing back problems.
Back to the symptoms again. You talked about the pain not only being in the back, but also sometimes actually being in the legs. And I think a lot of people may not realize that when they think of problems with their back, that it actually could be pain in other extremities, not in the back.
That's correct. One of the important functions of the back is to protect the spinal cord and the spinal nerves. And the spinal nerves that run through the back will eventually go out to the legs. And when those spinal nerves are pinched either by a ruptured disc or a bone spur, that pressure on that nerve can actually refer pain down the leg.
What about a bulging disc? I've heard of a bulging disc before. What is that?
A bulging disc is a term that describes a degenerative change in the back. And the terms we use to describe back problems are very confusing. You know, I've been in this business for, gosh, almost 30 years, and I get confused by all the terms. In general, however, if we try and make some sense out of all these terms, there's a group of terms that describes anatomic changes that occur in the spine, and there are another group of terms that describe the functional consequences of that. So for example, a term that would describe the functional consequence of that might be a backache, pain in the back, sciatica, pain in the leg. Anatomic terms that describe the degenerative process might be something like bulging disc, herniated disc, ruptured disc, bone spur, arthritis.
Well, you know, we've all heard of, or we've even used, things like hot and cold packs or heating pads, those kind of things, those sort of home remedies to help with back pain. At what point should someone go see a doctor with back pain?
Yeah, that's a terrific question. You know, I'm going to guess that just about everyone in our audience today has had a backache at some time or the other, and they know that it usually lasts for a few days, and if you lay low and sometimes take some over-the-counter medications, it'll usually blow over. But there are some red flags that we really need to be aware about that should trigger a visit to the doctor. One of the most important red flags is the development of a neurologic deficit, and by neurologic deficit I mean weakness in a foot or a leg or inability to control your bladder or bowels. Some other red flags that that might prompt an early visit to the doctor are a history of trauma. So for example, if you were in an automobile accident and immediately after that you develop pain in the back, you may have a serious injury in the spine and may need to visit the doctor. Another group of red flags are having a backache in an unusual context, and by unusual context I mean other symptoms that may suggest a more serious systemic illness. So for example, a backache that develops after a prolonged fever, it might be wise to visit a doctor in that situation. Or backache that develops after a period of unexplained weight loss, it might make sense to visit a doctor. And lastly, you know, if you've had just a backache that's not getting better or the pain's very severe, then that would be another reason to visit a doctor.
So if the back pain is not the sign of something more serious, what are some common ways that people can treat it themselves at home?
Yeah. One thing that people can do is restrict activities a little bit, lay low, if you will. Some of the over-counter medications may be helpful, things like Tylenol or ibuprofen. A lot of the pain in the back is caused by muscle spasms that we get, and if you can relax those muscles, it may help with the pain. So heat and massage, if you can get a massage at home, a spouse or a loved one to give you a massage, that may be very helpful.
How about exercise?
Exercise is helpful in preventing back problems, but it may actually exacerbate things if you're in a flare-up with an active back problem.
Now, you are a neurosurgeon, so you perform back surgery. At what point is a patient eligible for back surgery? When is surgery needed?
Surgery is needed in some emergency situations. For example, we spoke about patients who develop an acute neurologic syndrome, weakness or inability to control their bladder and bowels. That may need surgery right away, and surgery may be the only good treatment option for that patient. In general, however, most patients who have back problems from degenerative causes are probably best served with trying a little medical therapy first.
So let's talk prevention. What are some good ways to prevent back pain? We can't prevent ourselves from getting older, but there's got to be some ways to help prevent or at least slow the process.
Avoiding obesity and making sure we're very close to our ideal weight is very important. The extra weight associated with obesity puts more strain on the spine and causes it to wear out more quickly. Obesity is bad for a whole variety of other reasons. It increases your risk of diabetes and heart trouble and those sorts of things. Exercise is also very important. If we can keep ourselves fit, that also helps to reduce the incidence of back trouble. Low impact exercises, bike riding, swimming, are good ways to stay in shape. Sports that involve a lot of quick starting and stopping, what we call high impact sports, may actually put a little extra wear and tear on the back as well.
So Dr. Shiat, the back's it's pretty large. We've got the lower back, the upper back, and the middle portion. Is there something that you see that's more common as far as back pain? Is it in the lower or the upper?
Pain in the lower back is much more common than pain elsewhere in the spine. And that sort of makes sense when you think about how we're designed and how we walk, that most of the weight and most of the forces that we experience are going to be in the lower back because they bear all our weight and all our activities. So the lower back tends to wear out a little sooner and get aggravated a little more quickly than the neck, for example.
So let's say I'm having constant back pain, perhaps even pain in my leg, and I come in to see a physician like yourself. What's the next step? What happens? What can you recommend for me?
The next step would be to make sure we're not dealing with an emergent situation. And we could do that just through a history and physical exam, make sure your strength was normal and that sort of thing. If it's a relatively new problem, we may recommend some simple medicines, Tylenol or ibuprofen. Sometimes we prescribe another sort of medicine to reduce inflammation that we call steroid. Physical therapy seems to be important in treating both acute back problems and also preventing flare-ups in the future. Physical therapy in the acute setting is often directed at trying relieving the muscle spasms that are very commonly associated with backache. Chiropractic treatment, osteopathic manipulation, those are all other things that could be considered.
And what are the shots?
The shots are another mechanism to deliver a drug to reduce inflammation to the spine. One way that we can do it is to just give you pills by mouth, and an alternate way is to inject the drug directly in the spine.
What does arthritis have to do with back pain?
Arthritis is a term that encompasses a whole host of diseases. And by and large, when we're talking about the back, we're talking about degenerative arthritis, what we call osteoarthritis. So changes that occur from activities and honest work.
Probably a lot of it is so much internal too. Is there anything physical that patients may see with their back, swelling, redness, that kind of thing as well?
It's unusual to see swelling or redness in the back. But muscle spasm is commonly associated with flare-ups in the back pain. And that muscle spasm can produce tightness in the back. It can produce a change in posture. Some patients will actually develop what we call a list, which means that their spine is twisted because the muscles are pulling it in a different direction.
Well, before we run out of time here, any last minute words for folks who may have back pain or may want to prevent back pain from occurring in the future?
The most important thing we can do is focus on preventing back problems. We're all going to get back problems from time to time, but if we can avoid obesity and keep our weight very close to an appropriate weight and stay fit, that's going to really hold us in good shape for our whole life.
I'd like to thank our guest today, Dr. Douglas Chiat, neurosurgeon from Mayo Clinic Health System. A great topic today. Thanks for joining us.
Thank you for having me.
Have a great day, everyone, and be healthy.